A woman that is older than 35 is considered to be of advanced maternal age.
I like that. Can we repeat advanced maternal age, not geriatric pregnancy? We want to avoid complications, and when complications do arise, we want to catch them early. So that's in a nutshell, but obviously it's way more than that.
Also need to check the number of fetuses that the woman is carrying, because if you are having multiples, again, it's better identified as early as possible. Hello everyone, welcome back to episode 3 of ziRight Girls. I'm Dr. Tembelihle Masina. I am with my co-host.
Hi, I'm Dr. Thalia Isaacs, and on this channel we talk about all things gynae and girly related. We are here to help you through your reproductive journey, and we would like to make it as easy and as smooth as possible.
Thank you so much for watching and engaging in our previous episodes. But remember, to keep us going on this educational content, please like and subscribe and send us any questions that you would like us to cover in the future as well. So today we're talking about a very important topic. We are talking about antenatal care. Thalia, you've had a baby not so long ago.
Ooh, Lihle, I don't know if I would call him a baby anymore. We're now reaching the terrible twos. Send help!
So Thalia, what do our pregnant ladies need to know about antenatal care?
Ooh, Lihle, antenatal care is a huge topic. We could sit here all day talking about it. But essentially what the main aim of it is, we want to make sure that mom and baby get taken equally well taken care of. We want to identify if there are any risk factors. We want to avoid complications. And when complications do arise, we want to catch them early. So that's in a nutshell, but obviously it's way more than that.
So antenatal care is very important to have a healthy pregnancy for both mom and baby.
Yeah.
Okay.
So Lihle, who should be coming for antenatal care?
So everybody who is pregnant should ideally receive antenatal care. We preferably would like to see the mummies before they actually get pregnant. This is called preconceptual consultation. So at the preconceptual consultation, basically you are engaging with your obstetrician before you start trying to get pregnant in order to identify any possible risk factors, those that can be improved, like medical conditions can be improved. We identify medication that you are on, so that if there are medications that cannot be used, especially in the early stages of pregnancy, we can change them before you can actually expose your baby to those. And then if you happen to not get preconception counseling, then ideally we would like to see you as soon as you miss your first period, and usually that's around 6 to 8 weeks.
Why? Why is it important to see someone before 6 to 8 weeks?
So again, like you have mentioned, Thalia, that antenatal care is about identifying risk factors, managing them so that we can have a good outcome for both mommy and baby. But ideally, we want to make sure in the early stages of pregnancy that we get accurate dating, so that helps us to track that the baby will be growing normally. We need to locate where the pregnancy is sitting, because sometimes the pregnancy may be an ectopic pregnancy, which could be dangerous to both to the woman. And then we also need to check the number of fetuses that the woman is carrying, because if you are having multiples, again, it's better identified as early as possible.
Okay. So you're saying in pregnancy, it's like real estate. It's all about location, location, location.
Oh yes, the location of the baby is very important. And the earlier identified, the better.
So antenatal care is not just about cute pictures for your social media posts.
Oh no, it is so much more than that, although we do love a cute selfie with the baby in the tummy.
So antenatal care is to identify risk factors, try and minimize them, and manage them. Okay, cool. Lihle, how many visits do you think someone who is pregnant should have?
Okay, so we are guided by the WHO of basic antenatal care. So it's called Bank Plus. Ideally, every woman should see their healthcare worker, not necessarily a gynecologist, at least 8 times in their pregnancy. So it would be the first visit as early as possible. And then ideally, again, it's around 20 weeks. We will discuss what we do in each of these visits. And then from there onwards, we usually would strategize and see the woman every 4 weeks if she is low risk, or we would then tailor make the schedule of visits according to the woman's risk factors.
Okay, excellent. Good to know.
What can a woman expect on her first antenatal visit?
Okay, so firstly, we want to confirm the pregnancy. So this might be either by blood test or by a urine prognostic. And then we want to take a history and do an examination, and there's some special investigations that need to be done. So when we do the history, the first thing we want to know is when was your last normal menstrual period, or the LNMP. And this is the first day of your last period. Sometimes women get a bit confused when we ask this and they give you the day that the period ended, but that's not correct. We want to know the first day of bleeding. And
why is this important?
So we use this to date the pregnancy. So we use something called Nagel's rule. The first day of your period, we add 7 days to that and 9 months, and it will give us an estimation of your delivery date. Otherwise, add 7 days, and if it's after March, you can subtract 3 months and add a year. And that will give us the estimated delivery date. So after that, we'll take a history. And again, as I said, it's all about identifying risk factors, predicting what complications may arise, trying to avoid them. Also, we would want to manage any symptoms that the patient might have, like nausea and vomiting in pregnancy or morning sickness. We want to know about any bleeding in the pregnancy or any abdominal pain. Thereafter, we do an examination. It's still the same. We do a full head to toe, but we tend to focus more on the abdomen and pelvis. Can do a measurement, which is called a symphysis fundal height, which is also used to measure and track growth of the baby. And an example of this is, let's say mom is meant to be 28 weeks pregnant. Your SFH should be 28 centimeters. So every week should correlate in centimeters. If you are in private, you might do an abdominal ultrasound and do growth scans. So that will then tell you if the baby's growth is appropriate for where they are in their gestational age. And then very important is your blood pressure and your urine test. So blood pressure in pregnancy is very important because it's one of the top 5 leading causes of maternal deaths. So we're always checking your blood pressure. And then pregnancy and urine tests. Bladder infections are very common, very, very common in pregnancy for a number of reasons. But the complications thereof, besides it being uncomfortable, is it can make you have miscarriages, early labor, and it can infect your water around your baby and then end up causing infections to your baby. And also we check for protein when we have blood pressure. As I said, it speaks to one of those top 5 maternal deaths.
Oh, wow. So a lot is done during this first visit. Are there any other investigations or blood tests that need to be done in the first visit?
Yes. So we call them booking bloods. Booking bloods usually will include a full blood count. More specifically, we're looking at your HB or your hemoglobin. I like to add an iron level to this because as women, we menstruate, so we're losing blood regularly and we're more likely to be anemic. And anemia can decrease your immunity, so it makes it easier for you to pick up infections. It can also be a risk factor for excessive bleeding when you're giving birth. It's also important for the neurodevelopment of your child. So we're always checking for anemia and trying to correct that during the pregnancy. We do a blood group. So the blood group is whether you O positive or negative or A or B. Sometimes there's a mismatch between the mother and the father of the baby, and that can affect the pregnancy. So we're always checking that. And then we do an STD screen. So by virtue of falling
STD.
STD screen, yes. So by virtue of falling pregnant means you've had unprotected sex.
Excuse me?
Are you good?
Yes, we can continue.
So then we check for HIV and we check for syphilis. In private, we extend this to include hepatitis. These are the infections that mother can transmit to baby while the baby is in the womb. So syphilis can cause a lot of congenital abnormalities, but it's easily treatable. So if we pick it up early, we can administer antibiotics and hopefully prevent congenital syphilis. HIV, if we pick it up early, we not only improve mom's health, but we can prevent baby becoming infected in the womb. And then hepatitis as well, depending on how severe it is, might require treatment during pregnancy, or the baby might need some treatment after being born.
Oh, so there's a whole lot of things that are done in the first visit.
Lihle, we had a question from one of our viewers.
Hello, Dr. Messina and Dr. Isaacs. I wanted to know if I can get pregnant even if I am 37. Does this make me high risk, and what tests do I need?
Okay, so 37 is not too old to have a pregnancy. However, a woman that is older than 35 is considered to be of advanced maternal age.
I like that. Can we repeat advanced maternal age, not geriatric pregnancy?
Yes, advanced maternal age. And basically, the reason we categorize these pregnancies as advanced maternal age is because so that we can just pay a little bit more detail to the pregnancy, because the mom may have increased risk factors for other things such as Down syndrome. They may have comorbidities and things like that. So generally, if you are more than 35 years of old, you tend to have a higher risk pregnancy than a younger woman.
Okay.
However, things like Down syndrome can affect any woman of any age.
That's true. So what tests would we offer this particular mom or any mom in terms of checking for Down syndrome?
Okay, so there are a couple of ways that we can test for Down syndrome. There's screening test and there's confirmatory tests.
Yeah.
So the screening test, we either do a blood test, or in combination with a blood test, we also do an ultrasound, a special ultrasound called a nuchal translucency test, where we measure the thickness of the fluid at the back of the baby's neck in combination with hormone levels in the mother's blood, and that tells us whether the pregnancy has a high risk or the baby has a high risk or a low risk of having Down syndrome.
Okay.
So if there is a high risk, then your doctor will talk to you about further tests that you need to do in order to confirm if there is Down syndrome or not.
Okay. All right. Tell me a little bit about confirmatory tests then.
Okay, so sorry, before we move on to confirmatory tests, then this blood and ultrasound, they are up to 95% effective in screening, so they may pick up Down syndrome up to 95%. However, if we want a more higher sensitivity test, there is a test called a non-invasive prenatal test, or the NIPT, which is a screening test again, where they draw the mother's blood and they pick up fragments of the baby's DNA from the mother's blood, and then they are tested for possible risk of Down syndrome. Again, if this test comes back high risk, then the confirmatory test will need to be done. The NIPT is a very good test because it can pick up to, it's about 99% sensitive. So it leaves out those mummies that may have not been picked up by the biochemistry and the ultrasound alone.
Okay. Excellent. And then are there any other tests that high-risk women should be doing?
Okay, so confirmation for Down syndrome, obviously, if there's high risk, you discuss, and then they can talk about chorionic venous sampling depending on what gestational age the mom is, or amniocentesis. However, these tests are invasive and they can carry the risks to a risk to the pregnancy, such as a risk of miscarriage. And we discuss the importance of doing these tests, because for some people it may be really important to confirm, because in South Africa it is legal to terminate a pregnancy with a baby that is affected by Down syndrome up to 24 weeks.
Okay.
However, I always tell my clients that even if it is not for the purpose of termination, the reason we do antenatal care and all the screening tests is so that we are as best prepared for the baby as possible. Again, things like a fetal anomaly scan, which we do at 20 to 24 weeks, we may pick up some soft markers that can suggest Down syndrome, but also, even if there are no genetic abnormalities, some structural abnormalities, they plan how you're going to deliver the baby, because they may affect feeding, they may affect breathing. So you'd want to deliver a baby where the facilities are as prepared as possible for the baby.
Okay.
And then going forward with the pregnancy, again, we screen everybody for gestational diabetes. We do this with a test called an oral glucose tolerance test.
I had one of those. It's terrible. It's not nice.
Yes, so whenever I'm not sure if we did do a test, I always ask, did you have an OGTT? And if they can't remember, nobody wants to repeat the test.
No, it's something you will remember. It's so sweet and it makes you nauseous. Can you tell us a little bit more for those of us who have not had an OGTT?
Okay, so an OGTT, oral glucose tolerance test, is ideally done between 24 and 28 weeks. This is to pick up diabetes that may be identified for the first time in pregnancy. And this is because some of the pregnancy hormones may increase your sensitivity to
Becoming diabetic.
So basically, you come to the laboratory having not eaten, and then they check your sugar while you are fasting. They also then give you the sweet drink. Then they check how your body metabolizes this glucose. After 1 hour, they draw blood, and then after 2 hours, they draw blood. And there's certain values that the doctor looks at, and that will be diagnostic or clear you of gestational diabetes.
Okay. So besides diabetes being like terrible for everyone, and I say that tongue in cheek, why is it important in pregnancy?
Okay, so again, diabetes in pregnancy is a huge topic, but it is something that we would like to pick up because it can affect the growth of the baby. It can affect the amount of water. Again, if a baby is too big, it affects the way we will deliver the baby. If you have too much water, it can increase your risk of delivering preterm. And uncontrolled diabetes has a risk factor for unexplained stillbirth. So it is very important to screen and treat diabetes very well in pregnancy. But we will cover gestational diabetes or diabetes in pregnancy in another episode.
Okay. Wow, Lisa, that was a lot of very useful and important information. Thank you.
What is the purpose of third trimester antenatal care?
So you mentioned the bank and bank plus antenatal visit schedule. And if you look at it, like the bulk of the visits are actually in the third trimester. In the third trimester, we are monitoring growth. So you're coming and making sure, like I said before, that the size of your tummy and the weight of your baby correlates to how far pregnant you are. And we are screening again for things like growth restriction, meaning the baby is not putting on adequate weight. We want to make sure that there's enough water around the baby, so for stretching and for lung development. And sometimes we also check the pressure in the cord to make sure that there's enough oxygen supply to the baby. And then later on in the pregnancy, usually after 36 weeks, this is when your obstetrician will start discussing modes of delivery with you. So at that point, we're looking at the way the baby is positioned or presenting, whether it's bum first or head first. We're looking to see whether or not the baby is too big or too small. We also want to make sure things like your afterbirth have shifted out of the way if those were in the way earlier on in the pregnancy. So there's quite a bit that happens in the third trimester, but it's sort of geared to making sure that the delivery and the arrival of baby is safe and mom is also safe. Also, in the third trimester, if you haven't had an issue with high blood pressure before, it tends to crop up in those last few weeks. So, again, your blood pressure and your urine checks and analysis are very important in the third trimester.
Okay. And when would you ideally want to deliver?
It depends. Lihle, it really depends on person to person and pregnancy to pregnancy. Depends on your risk. So a low risk pregnancy in a young healthy mom, for example, and I am generalizing. Let's take a 26-year-old mom, first time pregnant, never had any past medical history. She's had a healthy course and the baby's not overweight and not underweight. Then we would give her 10 additional days after her due date to go into spontaneous labor before we would want to intervene. Ideally, we want to get that baby out before 42 weeks. So 40 weeks is your due date. We would wait 10 extra days before we start inducing. If you had a medical condition, it would depend on the medical condition. So diabetes, a well-controlled diabetic who's not on any medication, who's just being managed on diet, the baby's not overweight or underweight, we would end the pregnancy at 40 weeks. If there was any medication that was added, or the baby is overweight, or there's any like other risk factors, we might want to end that pregnancy at 38 weeks. It depends on whether or not you have a twin pregnancy. So it really is person to person, and your delivery plan would be adjusted to suit your specific set of risk factors.
Oh, so you should not panic on your estimated due date if the baby hasn't come yet.
I think the pertinent word in that sentence is estimated due date. You are due anytime from 37 weeks to 40 weeks. You can go into spontaneous labor. If you did not go into labor by your estimated due date and you are low risk, you can be given additional time. But you need the baby to be born before 42 weeks. 42 weeks makes me anxious. It makes me a little bit nervous, but you can, if there's no risk factors, your blood pressure is fine, and you and your baby are healthy, you can be given additional time.
Okay. All right. Thank you, Thalia. We have said a lot about antenatal care, and there's still a whole lot more to cover.
Yes. Like we said in the beginning, it is a big chapter, and we can sit here talking about it for days.
Okay, so today we were informed about the importance of antenatal care. So things to remember is ideally you should get a preconception visit, or if not, then you book as early as possible, ideally before 8 weeks. And then you will be, a thorough history will be taken, and some blood tests will be taken as well. And remember that not all investigations will be applicable to you, but it's an open discussion between your healthcare worker and your family.
Remember, guys, antenatal care is a sign of love for yourself as well as your growing baby. Thank you for tuning in this week. We hope to see you in the future, in our future episodes. If you have any questions or you have any topics that you would like us to address, please leave them in our comment section. We love hearing from you, and we love making content that is applicable to you. So don't forget to like and subscribe and leave us some comments in the comment section. We hope, until we meet you again, that you are
ziRight to go.